Everyone, today we will be learning about facial nerve lesions, and of course this is a bit confusing topic. That's why I have made a video on this. So let's start the topic. This is the cerebral cortex, okay, and the neurons arising from the cerebral cortex are the upper motor neuron, and this is the facial nerve nucleus, and these are the lower motor neurons coming directly to the face. Okay, now we have to remember what happens to the face, or what are the effects of the lesions if the upper motor neurons are involved, and what happens if the lower motor neurons are involved. So first, starting with the lower motor neurons, always ipsilateral. That's a really easy one. If anything happens to the facial nerve of the right side, or if anything happened to the facial nerve of the left side, the ipsilateral side will be affected. That means if the right side facial nerve is affected, then the right side of the face will be affected, and if the left side of the facial nerve, or if the left facial nerve is injured, then the left side of the face will be affected. So lower motor neuron is always ipsilateral. Now that have made this topic easier already. Now talking about the upper motor neuron. Now first of all, you have to see that which part is innervated by which nerve. Now this is the upper part of the face, and this is the lower part of the face. The upper part of the face is getting the nerves from both the sides. Let's look at this nerve only, which is supplying the upper part of the face. This nerve is getting the connection from both the cerebral hemispheres, or from both the sides. Okay, that means if anything happens to the right upper motor neuron, nothing will happen on the upper side of the face. If anything happens to the left upper motor neuron and the right one is intact, nothing will happen to the upper part of the face, upper half side of the face. But if both the neurons, that means the right one and the left one, both gets injured, then there will be only the half upper part that will be affected. Okay, so that means to make the upper half of the face to injured, or to make this part affected, you have to destroy both the neurons coming from the cortex. That means it's not easy for a person to get his upper half of the face affected. Now coming to the lower half. Of course, we are talking about half of the face. Now talking about the lower part. Lower part is innervated from, you can see this nerve at the lower part is getting connections from the contralateral cortex. So this means the lower part of the face is getting connection from the contralateral side. So if anything happens at the left side of the upper neuron, left side of the upper motor neuron, then the right side and the right lower side will get affected. And if anything happens to the left upper motor neuron, then the right lower half of the face will get affected. So that's really easy. You just have to remember two things: that upper part of the face is getting neurons, or is getting the connection from both the cortex. That means ipsilateral and contralateral, both neurons have to get affected in order to make this part affected. Okay, and the lower half is getting connection from only the contralateral cortex. So if anything happens at the contralateral cortex, the contralateral side of the lower face will be affected, and lower motor neuron always ipsilateral. Okay, I hope this has made your concepts and this has really made this topic easy for you. And if you really like this video, and if it really made this topic easy for you, then please do like this video and subscribe this channel. Thank you.